Okay. Come in. Good morning, Miss.
Morning, Doctor.
Okay, my name is Nisa, Nadhirah, and I'll be your doctor for today. Before we proceed, can I just know your name and age, please, Miss?
I'm Safia, 25 years old.
25 years old.
Yeah.
Okay, so you're Miss Safia and you're 25 years old. Okay, Miss Safia. So today I'll be doing a little bit of like consultation to know about your condition. Will that be okay?
Yeah.
So whatever we discuss will stay in between us. Alright? Okay. So Miss, what brings you to the hospital today?
Actually, Doctor, I've been coughing for quite some time now.
I see. Do you remember how long it's been since you started coughing?
If I'm not mistaken, started 2 months ago.
2 months ago.
Yeah.
I see. So can you just explain to me how it first started? For example, was it just suddenly, or did it occur gradually over time, or worsen gradually over time?
Yeah, it was gradual. Like at first, it was terrible. But then I started to cough more and more.
I see.
Yeah.
So whenever you cough, right, Miss, would you have phlegm in your cough?
I think yeah, because at first my cough was dry.
Okay.
But then maybe like 2 weeks ago, I started to have phlegms.
You start. Okay.
Yeah.
All right. So when you see this phlegm, can you describe more about the phlegm to me, please?
I think it was quite thick.
I see.
It was yellowish, and I think like a few days ago, I also noted greenish color.
Okay.
And sometimes it has like some streaks of blood.
Some streaks of blood.
Yeah.
Okay, I see. All right. Okay. All right. Is there any time of the day where you feel like your coughing will start to worsen, for example, in the morning or at night?
I think there's no like specific time. Like it's just constant throughout the day.
Constant throughout the day. I see. Okay. What do you do to relieve the cough, Miss? Or is there anything that worsens the cough?
Yeah, I take cough syrup and like 2 to 3 times a day.
Okay.
But then it's just a temporary effect. Like my cough is just like really in a short duration. It's like the next day I just started coughing.
I see. So you've been taking this cough medication daily?
Yeah.
Alright.
2 to 3 times.
2 to 3 times. How about anything that worsens your cough, Miss?
I think like when I'm around like smoke, when I'm around smoke, I find it very hard to breathe, and also my cough just gets worse.
The cough just gets around smoke and
smoke.
Okay. Okay, apart from your cough, Miss, are you having any other symptoms? Can you recall?
Yeah, actually past few weeks. I'm not sure if it's like before or after the cough, but I had fever also.
Alright.
Yeah, I have fever. And also some difficulties in breathing.
Difficulties in breathing. I see. Okay. Let's talk about the fever. Can you explain more about the fever to me?
I think last Monday, I first had the fever. It was 2 days.
Alright.
And then that 1 week, I had 2 to 3 times. And for the once I get fever, it will last me more than 2 days.
It will last more than 2 days. So whenever you get these fevers, would you measure your temperature?
Oh, not really. I don't have the thermometer.
Okay.
But if I were to describe the fever, it's hot inside, and sometimes I would sweat a lot, especially at night.
Alright, especially at night.
Yeah.
So you get very heaty at night then.
It's very hot.
Would your clothes or your bedsheets get drenched by the sweat?
Yeah, I noticed that.
Every night? Or whenever you get the fever?
Whenever I get the fever.
I see. Is there anything you do to relieve the fever?
I think Panadol.
Panadol.
And sometimes I wear the cold fever patch.
Okay.
But again, it's just like a temporary
thing. Okay. How long does the fever last usually? So you'd say you have the fever in the evening, right? Would it extend to the next day or?
Yeah, it will last for a few days.
Okay. But again, it would worsen in the evening. Alright. Okay. Just now you mentioned about breathing difficulties. Let's just explore a bit about that. How long has that been happening?
I think like around 1 month ago, when my cough started to get worse.
I see.
That's when I started to have very difficult breathing.
Okay.
It was difficult to breathe even when I'm not doing anything.
Even when you're resting?
Yeah, even when I'm resting. And also sometimes I'll have like chest pain.
Okay.
And also it's more painful whenever I take deep breath.
You take deep breaths. Okay. When you have the breathing difficulties, right, Miss, is it hard for you to talk sometimes? Like, can you only say a few words?
I don't think it's that bad. Yeah, I can still talk.
Alright. But it would hurt your chest whenever you breathe in deeply. I see. You mentioned that you feel the pain in your chest area every time you breathe in deeply. So can you point out where exactly the pain is around your chest?
I think it's here.
Oh, I see.
On the upper part here,
Alright.
and then this one here.
Okay.
Yeah.
Does it spread anywhere in your body?
Like it hurts a lot there.
Alright. Not even to the back or like this down. Okay, I see. So is there anything you do to relieve the pain?
Sometimes I will like hunch myself forward to relieve the pain. I think that's it.
Okay. So can you describe how the pain feels like?
It's like a stabbing pain.
Stabbing pain. Again, whenever you're taking the deep breath. So on a scale of 1 to 10, how would you rate the pain as?
What's that? Not the 1 to 10.
Oh, 1 being, I'm sorry, on a scale of 1 to 10, 1 being maybe not as painful as you think, and 10 being the most excruciating pain as you can feel.
Let's say 6.
6 out of 6. I see. Alright, Miss, can I know whether you've been having any weight loss or loss of appetite at the moment?
Yeah, I actually noticed that I'm 10 kg lighter.
Okay.
If I compare myself to like 1 month ago.
Alright.
Maybe I was 64 that time, now I am 54.
Okay.
And also I think because I don't really have appetite this recent few months, I don't have the appetite to eat very well.
Alright.
So I think maybe it's because of that too.
Okay. So when you say loss of appetite, did you see any changes in your daily eating routines?
Yeah, I'm actually quite a balanced eater. I eat 3 meals a day.
Okay.
But then I noticed that I'm very eating these days. Can't finish a meal.
I understand. So do you feel any tiredness or do you feel lethargic these days?
I actually have.
Okay. Alright, Miss. I would like to ask you a few other questions regarding your condition. Do you have this breathing difficulty every time you lie down? No. How about when you go to sleep, during the night when you sleep? No breathing difficulties?
No.
Alright. Have you ever noticed your leg swelling all of a sudden? No. Any changes in bowel movements, for example, if you've had any diarrhea, constipation?
So far, no.
Okay.
I don't notice that.
Okay, and aside from your current condition, have you been feeling nauseous and have you been vomiting?
I haven't seen no.
Okay. How about your urinary habits? Does it hurt when you try to go to the toilet and pee?
I don't think so.
Okay. Do you see any blood in your urine perhaps?
Yeah, no.
No, okay. Have you been going to the toilet more frequently than you had before?
No.
It's been normal then. Okay. How about headaches? Is there any headaches?
I think sometimes when I'm like very stressed.
Very stressed
my
out.
work.
Okay. Any, I see. And then do you have any dizziness whenever?
No.
Okay. Do you have any problems seeing things or hearing things?
No.
Okay. How about any joint pains or pains around your forehead area?
I've seen.
No. Okay. Alright, Miss. So now I'll be moving regarding your medical background a little bit. I'll be asking you a few questions. Are you okay with that? Are you okay with to continue?
Yes.
Alright. Okay, Miss. Before I proceed, I was just wondering if you've been experiencing these symptoms or this similar condition before?
No. This is like my first time ever having this
Your
type of
first time.
symptoms.
Okay, I understand. And apart from the problem, do you have any other illnesses or underlying medical problem within you?
For example?
Do you have any diabetes or if you have any high blood pressure that you would like to tell me about?
No, I think so far I've checked myself and alhamdulillah nothing.
Okay, that's good to hear. Alright. How about any operations, Miss? Have you ever undergone any kind of surgeries before?
No.
No. Okay. I'd like to ask you a bit on your family. Is there anyone else in your family that's experiencing similar conditions, similar symptoms as you were?
I talked to my parents last few days and so far they are healthy.
I see. That's good to hear. I'm glad to hear that for you. Okay, I would like to ask, in your family, is there anyone who's having any underlying illnesses that I've mentioned before, for example, diabetes or high blood pressure?
So far I don't think so. They are all healthy, but yeah, my father,
Your father?
I think he has like high blood pressure. I'm not sure if it's like well controlled, but he has been going out to follow-ups.
I understand. Alright. Okay. I'm sorry, Miss, for asking this. I know it can be a bit sensitive, but would you perhaps know if someone in your family has ever had cancer before, maybe a relative?
I don't think so. I've never heard of it.
You know, okay. To reconfirm, Miss, you've been taking Panadols for your fever as of now and the cough syrup to counter your coughing. Can I know if you're taking any other medications at the moment?
medications, I don't think so, but I'm actually taking vitamin C.
Vitamin C is okay.
Yeah, I just bought it from the pharmacy.
Okay, alright. Do you have any allergies to any kind of medications if you can recall?
I don't think
You
so.
don't think so? Okay. You mentioned that you ate 3 meals a day. Can you tell me more about that? Yes. About your diet?
Yeah, I think I eat pretty balanced diet.
Okay.
I eat my breakfast. I usually have some bread and then I eat my lunch.
Okay.
I'll never skip meat, fish,
Right.
chicken, and also vegetables.
Mm-hmm.
And at night I'll just eat some salad, sweet roasted chickens.
I see, that's good.
I also take fruits.
Okay. But because of the condition that you are right now?
Yeah, I'm actually losing a lot of appetite.
Mhm.
It surprises me so.
I understand. Okay. Do you have any allergies to any kind of food? Do you
I don't know. So far, no allergies.
No allergies. Okay. Right, Miss. Now I'd like to ask you a little bit regarding your social background and environment. Are you okay with continuing?
Yeah, sure.
Okay. So firstly, I'd like to ask on where you live.
I was born in Malacca, but around 2 years ago, I moved to KL because of my work, and I live alone.
You live alone.
Yeah.
Okay. Yeah, you mentioned that you call your parents every time.
Yeah.
Mm-hmm. Can I know what kind of living conditions that your living conditions at the moment? That your house perhaps?
I live in an apartment
Okay.
with my roommates.
Your roommates.
I have 2 roommates.
Okay. Okay. How about your job? Can you tell me more about what you do in general?
I work as a manager in a paper factory.
Okay.
So what I do is like I will be in charge in monitoring the employees' progress.
Mm-hmm.
Most of them are foreigners from other parts of Asian countries. So I just monitor their work and their progress.
I see. If you can recall this, I would just like to ask if anyone or your colleagues perhaps have contracted a disease recently.
Now that you have mentioned it, I think I noticed that few of my workers, they were hospitalized. I think like 3 months ago.
I see.
I'm not sure why, but there were a few.
There were a few. Okay. Traveling history. Have you gone anywhere recently? For a holiday?
I've been a little busy these days.
Okay.
Sometimes I just go to the parks.
To the parks. Okay. Alright, Miss. I'm sorry in advance. The next few questions might be a little bit private to you. But it is necessary for me to ask because it might be related to your condition as of now. But again, it is confidential between just you and me. Alright. Thank you so much. Okay. I'd just like to know if you smoke, Miss?
I do smoke sometimes, like occasionally.
Okay.
I vape.
Alright.
When I go out with friends. But that's not often, it's just maybe around weekends.
Alright. Can I know, maybe if it's vapes, how many puffs do you take at a time?
Usually 2 to 4 puffs.
2 to 4 puffs. I see. What about alcohol, Miss? Do you drink often or?
No, I don't drink.
Alright, I understand. I'm sorry, Miss. Can I ask if you've been sexually active with anybody as of now?
No, that time single.
Okay. Oh, I understand, Miss. So I think that's about it regarding the questions that I'm about to ask you. Now I'd just like to know if you have any ideas about your condition.
I'm not sure, but I googled some of my symptoms.
Alright.
There's just like a lot of chest-related diseases that I'm not sure of. So yeah, I'm actually not sure what I'm having.
Okay. Do you have any concerns that you'd like to address to me regarding your condition?
Yeah, because like I'm coughing very badly and I think like my condition has worsened.
Okay.
I am scared that I have to like take a lot of leave from my work.
Okay.
Because I have to feed myself, I have to like send my family some money
Okay.
also, so I really need this job. And apart from that, I think like my coughing is actually affecting the working surrounding of the people around me.
Okay.
So I often find it uncomfortable when I cough really badly.
Okay. I understand, Miss. It must have been hard for you to go through that. Okay. So would you like to tell me what you expect from our side of the...
I would want to know my diagnosis as soon as possible.
Okay.
If it's possible, I think I want to get treated quickly. I want to get over this.
Okay. Alright. So I think in the next few sessions, we'll do a little bit of examinations on you. So we'll try our best to provide a proper treatment that could, possibly regain your health and, bring you back to work as fast as possible. Okay?
Right.
Should you have any questions? Oh, if you do you have any questions regarding
So
anything?
far, I don't think I have any.
Okay, so we'll try our best and we'll go through with the examinations later. And if anything, I'll make sure to inform you.
Alright.
Okay? Thank you so much for your cooperation and time. So I think we can proceed to the vet so I can check your chest a bit.
Okay.
Okay? Okay? Okay, Miss. Alright, Miss, I'm now just going to take a look at your hands real quick, okay? Right. Is there any pain around your hand? No? Okay. Right. Okay, Miss. Now I'd just like to see your hand real quick. Right. Okay, and the other hand. Sorry, Miss. Okay, Miss, if you don't mind, can you do this, and put your fingers together for me? Alright. Sorry, Miss. Alright, thank you. Okay, Miss, I'll be checking your eyes now. Okay? Can you look down for me? Can you look up for me? Okay, so now I'll see your mouth. Okay, that's okay. Can you put your tongue up for me? Alright, that's okay. Okay, Miss, right now I'll be checking your chest area. Do you mind just exposing your chest for me? Okay. Alright. Okay. Okay. Okay, Miss, I'll just touch your neck area real quick. It'll be a little bit uncomfortable. But just tell me if you have any pain, okay? Okay. Okay, Miss, can you just breathe in for me? Okay, can you just breathe in for me? Can you just breathe in for me real quick? Can you just breathe in for me? Okay, and I'll just be tapping lightly on various areas of your chest. Tell me if you feel any pain. Okay? Okay, Miss, so now I'll be hearing 0 alarm sounds, okay? Okay, Miss, when I put my stethoscope on your chest, can you just breathe in and breathe out? Alright? Okay? Breathe in, breathe out. 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 Okay, now, Miss, whenever I place my stethoscope on your chest, can you say the word 99 for me? Alright, okay? 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. Alright. That will be all, Miss. I'll proceed to check the back of your lungs, yeah? If you could just sit for me, I'll just check and we'll do the same thing real quick. Okay. Thank you so much. Alright? Okay. Okay. So thank you so much. I think that's it for our examination. I'll just you can put on your clothes back. Thank you, Miss. We'll see each other again later at the consultation room. Okay, Miss, have a seat. Have a seat, guys. So, alright, Miss. Okay, so from the examination that I've done just now, I believe we'd have to send you in for a chest X-ray just for further workup. But I'm sorry to say this, but there might be a higher risk that you've contracted something infectious. But no need to worry. What you need to do now is just I would have to acquire some of your blood samples so that we can run some tests just to confirm your condition. And also I need a sample of your phlegm. I will give you a cup later on so you can cough into it. And we should be able to see if the bacteria causing this specific disease is inside your phlegm. Alright? But I hate to break it to you, we might have to admit you to the ward as of now before we receive the results from the lab. Will that be okay with you?
Yeah, I think I just have to contact my family members.
I see.
Before I get me.
Alright. Do you have any questions regarding the management as of now?
I don't think so.
Okay. Alright, Miss, thank you so much for your cooperation.
Thank you,
Yeah, I'll guide you to where you're supposed to go next. Okay, good morning, Miss. I'm Dr. Nisa from the other day. Okay, today we'll just discuss a bit on the lab results that we received. So we just got back the results from last week, okay? And would you be okay with that today?
Yeah.
Alright. So according to the lab results and the chest X-ray that we've done to you, apparently you have this condition called tuberculosis. Are you aware of what it is?
Yeah, I've heard of it.
Mm-hmm. So tuberculosis is a disease that normally infects your breathing system. And for our management today, I'll give you around 4 medications for you to take every day. And I'll explain to you further about the medications and when you have to take it. So you have to take it for the next 4 months. And during the next 4 months, you will have to come to the hospital every day in order for me to check, or the hospital staff will check if you are actually taking the medication basically for compliance. And we'll also be giving you medication for your fever as well as your cough if you've been having those still. And I would like to inform you as well that you can be discharged today, but I advise you to put on your mask every time you're out somewhere. Alright?
Alright.
Okay, do you have any questions regarding the management, Miss?
I don't think so.
Okay. Alright. Thank you so much for your cooperation. Bye.